States was spending money to slow the population growth of responsible families, while at the same time providing financial incentives for ignorant, feeble-minded, and lazy people to have more babies. He said that history would rightly condemn the United States if we didn't link welfare to family planning. At that time, Eisenhower was the co-chairman of a Planned Parenthood fundraising campaign, along with former Democratic President Harry S. Truman.
John Ehrlichman, who was an assistant to President Richard Nixon, wrote that Nixon once told him that African Americans could not really benefit from federal programs because they are genetically inferior to whites. Later, Nixon would label birth control a national priority and sign legislation to make it available as a service of the U.S. government. Then, in March of 1972, the Commission on Population Growth and the American Future, which Nixon had created 3 years earlier with the help of congressional Democrats, began calling for the nationwide legalization of abortion.
The concept that abortion and birth control could be used to save the government money was well established by this point in history. In 1969, Joseph Kershaw, who was a researcher with the U.S. government's Office of Economic Opportunity, stated that the agency had closely studied the poverty issue and found that the single most cost-effective way for the government to address it was through family planning. In other words, through abortion and birth control. And that sort of thinking is still very much alive today. On January 25th, 2009, the Speaker of the United States House of Representatives, Nancy Pelosi, said on an ABC News program that the government's economic stimulus package should include a large increase in spending for population control. She said that this could save the state and federal governments the cost of having to pay for the health care and education of poor children. Not surprisingly, Pelosi has a 100% approval rating from Planned Parenthood.
At one time, it was common to hear politicians and elected officials openly talking about the need for population control in the black community, or saying things like $1 spent on family planning is worth $5 spent on economic development. But since we don't hear that sort of thing anymore, it would be easy to conclude that the government is not still involved in black genocide, but that's not the case. Look, it's no longer necessary for the government to be directly involved in black genocide because that's what they hired Planned Parenthood for. I mean, it can't just be a coincidence that at the same time when government population control programs were backing away from specifically targeting black neighborhoods, at that same time, the state and federal funding for Planned Parenthood was being increased by leaps and bounds. To understand the magnitude of the dollars involved here, remember this. By 1970, Planned Parenthood was already the 19th largest health-related fundraising organization in the country. But by year 2000, it had moved into third place behind only the American Heart Association and the American Cancer Society. And a major factor in that phenomenal growth was government funding. Basically, what's happened over the last 40 years or so is that Planned Parenthood has taken billions in government money while locating the vast majority of its facilities in minority neighborhoods. And that has not only been a tremendous boost for the eugenics movement, but it has also allowed government-funded family planning programs to target the black population while insulating the government from any direct connection to black genocide.
One of the places where government money has been used to advance the eugenics agenda has been in the public school system. Although government-funded population control programs can be found in white schools, the evidence is that they are significantly more likely to be targeted at black schools.
One example of this was seen in 1986, when it was discovered that Illinois public schools were not only distributing birth control to children, but that every one of the 50 facilities involved were in minority neighborhoods. When this information was made public, a local African-American pastor organized a campaign to stop the program. Reverend Hiram Crawford labeled the project genocide, saying that the obvious goal was to go after the Hispanic and black population.
That same pattern was also found in Maryland in the 1990s. Even though the state's teen pregnancy rate was higher among white students than black students, when the contraceptive device Norplant was introduced, it was selectively marketed to children as young as 13 in predominantly black schools in Baltimore. The result was that of the first 350 girls implanted at a local middle school, 345 were African American. Then, when Norplant was approved for general distribution, of the first 100 schools selected, all 100 were in minority neighborhoods.
The Norplant contraception device was developed by the Population Council in New York, which had been established in 1952 under the leadership of its president, John Rockefeller. Its next two presidents, Frederick Osborne and Frank Notestein, were both former members of the American Eugenics Society, and Notestein would later serve on the National Advisory Council of Planned Parenthood.
If you're going to curb population, it's extremely important not to have it done by the damn Yankees, but by the UN. Because the thing is, then it's not considered genocide. If the United States goes to the black man or the yellow man and says, "Slow down your reproductive rate," we're immediately suspected of having ulterior motives to keep the white man dominant in the world. If you can send in a colorful UN force, you've got much better leverage. Alan Guttmacher, president of Planned Parenthood and former vice president of the American Eugenics Society, 1970.
4 years after Guttmacher made that statement, America's National Security Council issued a report that was intended to define the United States government's official policy on controlling world population. It was called the National Security Study Memorandum 200, or NSSM 200, and it was formulated in cooperation with the United States Agency for International Development, the U.S. State Department, the Department of Defense, and the Central Intelligence Agency. One of its goals was to establish a strategy for reducing the populations of third world countries so that the United States could have increased access to their natural resources, particularly minerals and metals.
Among the conclusions of NSSM 200 was that no country has reduced its population growth without resorting to abortion. The authors of the report then identified 3 non-governmental agencies that would be funded to carry out the government's population control agenda in the targeted countries. One of those agencies was Planned Parenthood.
One of the tactics specified in NSSM 200 was that we might withhold food aid after a disaster if the countries do not accept the American idea of birth control, and this has happened many times all over the world. One example is the Southern American country of Guyana, which was hit by a hurricane back in 1997. Now, they had turned down abortion and birth control for 12 years straight, but after the hurricane hit Guyana in 1997, the World Bank said, "We will not give you any aid unless you legalize abortion and birth control," and that's exactly what they did. I've seen this several times in Africa, where droughts have hit, and the United Nations and USAID will not assist unless they accept birth control. I've been all through Africa myself, and I've seen medical clinics that are full of birth control devices, but no safe motherhood delivery kits. There's no anesthesia, there's not even any bandages there. There's crates and crates of birth control pills and condoms. Now, while our commitment to birth control is going up every year, our commitment to authentic economic development is dropping. So we see less clean drinking water funding, less school funding, see less medical clinic funding. Another example is Haiti. Haiti has been hit by hurricanes several times, and the United States and other countries are saturated with birth control. In Haiti now, any woman, 90% of women at least, can now get access to any kind of birth control they want to, government funded, but less than 20% of the Haitians have access to clean drinking water. Now try to imagine there being a natural catastrophe in a country like Canada or Australia or France or England. And we go in there and we say to them, "We're not going to offer you any kind of aid unless you accept our philosophy on birth control and population control." That will be outrageous. But that's our standard operating procedure when we go to a black country after a catastrophe of some kind. You cannot believe that we are going to treat people in a foreign country like this and not treat our own population of African Americans the same way. Consider what happened after Hurricane Katrina. One of the first things we did was bring in birth control and contraception. And as we all know, the hurricane disproportionately affected black families in that area. And I seriously doubt if the same kind of disaster hit a middle-class